Medical professionals of Reddit, have you ever had a patient so lacking in common sense you wondered how they made it this far? If so, what is your story? I'm a vet. A few years ago I had a client bring his young cat in complaining of lethargy. Besides being a bit underweight, the physical exam was unremarkable, so I asked more questions about the cat's diet. Me: what do you feed the cat? Owner: online trendy raw food brand. Me: how is his appetite? Does he finish what you feed him? Owner: yes, he always eats everything. Me: how much do you feed him? Owner: 1/2 cup. Me: once or twice daily. Owner: once every 3 or 4 days. Me: you only feed your cat twice a week? Owner: I believe in a more natural feeding approach, and based on my research that's how often cats eat in the wild. This owner was slowly starving his cat to death based on some cockamamie idea he'd made up watching National Geographic. I had to explain to him that domestic cats are not tigers, and that small wild cats eat 10 to 20 small meals daily. Surprise, surprise, the cat's lethargy and weight improved with regular feeding. I'm in the ER. So many stories. The one that left me dumbfounded was a woman was borrowed in by her sister for pelvic cramps, amenorrhea for 3 months. Lo and behold, she's pregnant. Sister informs me that she sleeps with the Brazilian construction workers building the condo complex next door. I ask if they have any questions. The patient asked me if her baby would come out speaking Spanish. After a long pause, and her sister staring at the ceiling, I told her, no, because they speak Portuguese in Brazil. Patient seemed relieved and the sister hustled her out of the ER before I could discharge her. I used to be a medical oxygen tech, mostly doing in-home work. One guy was on such a high concentration that he would have drawn nearly zero oxygen from breathing regular atmosphere. This required 2 heavy-duty machines hooked up in tandem just to keep him barely alive. This was explained ad nauseum to him and his wife with full signed documentation of every conversation. They'd shut one machine off because they decided it was too loud. He'd take his mask off because he decided it was too cold. She would unplug the hose if she decided it was in the way. So on and so on. Literally everything you could think of that would restrict or cut off his oxygen intake. Then they would panic and call our emergency service when he started to have a reaction to no oxygen intake. I lived not even 5 minutes away, right beside Out M's fire station, and the call would always come to me to fix the machines at random times of the day and night, 3 to 7 days a week. They refused to call 911 because they didn't want to make a scene. This went on for ages, well over 18 months, until he was having trouble sleeping one night and shut the machines off before going back to bed. It's been years and I still see the wife around town. She always glares at me as if I'm the one who killed him. Saw a chart once where a person came in for a burn to their eye. They told the doctor they read online that warm milk in the eye can help with irritation, and their eyes were irritated. So they boiled milk on, then poured it in their eye. Burned it all. Rural doc here. 35-year-old female walks in with right-sided jaw, neck swelling. I think it happened because I ate some meat yesterday that my body is reacting to. 10 minutes later, oh yeah, and I accidentally swallowed a bee and it stung my mouth right before this happened. Sorry, I forgot to mention that. Optometrist here. If I had a nickel for every time someone said they use urine for eye drops, I would have 10 cents. Which is not a lot, but it's weird that it happened twice. Had a patient come in for facial burns because he smoked while wearing his oxygen, twice, in the same week. Not me but my wife, who is a vet. Had a client who got mad at her because he didn't realize that once he neutered his dog that he wouldn't be able to breed it. This happened in med school on my OB/GYN rotation. Patient: who's the baby gonna look like? Me: what do you mean? Patient: well, is it gonna look like the dude who got me pregnant or the guy who's been nutting in meth last few months? Me: utterly speechless. The baby should look like the people who conceived it. This person is now a parent. Edit. Fixed a typo. Lady brings her baby into the ER with a rectal temp of 103. Kid's tacky as hell and looks like hit. Refuses all medications. Says she doesn't believe in them and wonders why her herbal tea, she brought a jug of it, isn't working. Wants us to just check her out. Thinks a children's emergency room just checks them out. Try to explain why the kid needs an NSAID. Keeps refusing. Says she doesn't know what's in it. I bring up that fact she had her kid in a hospital, and that she recovered medication herself, IV, epidural, etc. Doesn't budge. Only concerned for herself. Told her that when the kid has a seizure or goes unresponsive and you call 911, you can expect the medics to give the kid everything it needs regardless of whether you like it or not. Only when the doc threatened to contact social services for child endangerment and abuse did she start to listen. For like 5 whole seconds. Left against medical advice. People like this exist and breed. So, you're lactose intolerant? Yes. And you knew this before? Yes. And you drank a milkshake? Yes. What size? Large. The rest of the night was the kid screaming and groaning in the ED waiting room. My sister told me a story of a woman with chronic blisters and lesions on her lips. They couldn't figure out what it was for weeks. It would heal and come back. Heal and come back. Turns out she would jam out on like 3 bags of salt and vinegar cheap a day for weeks at a time until the sores hurt too bad to continue, then she'd go to the doctor. I worked ed for 10 years. Every day. Everyday people come in and it shocks you how they managed to evade a death for that long. One of the worst was we had a guy come in. He was a twin. He told us he needed to get checked for STDs because his sister apparently just got one. We of course had to ask if he has had X with her and he said no, but they were twins so what she has, so does he. After a collective sigh of relief that this wasn't some weird Alabama "you're my sister" hit, we had to educate him that is not how it worked at all. Had an adult male patient who needed a Foley catheter. His mother was in the room, and they both lived together in the backwoods of TN. I informed them both of the order for a catheter, how it works, and why it was needed. His mother stated, "Well, he's still a virgin and I'm not sure I'm comfortable with his virginity being taken in a hospital." Not me, but my mother would pick up shifts as a nurse sometimes in labor and delivery, and she had a handful of women who didn't know the baby was going to be coming out of their vaginas. Like no clue. My mom usually said something like, "How you got it in is how it's coming out, honey." This was late 90s, early 2000s. Had an 18 or 19-year-old girl come in my ER with some complaint that required an X-ray. ID standard that we do a urine pregnancy test prior to imaging on any female of childbearing years. She insisted she'd never had X and there was zero possibility of pregnancy. We did the test anyway and it resulted that she was pregnant. We did a blood pregnancy test to confirm the result, since she insisted she couldn't possibly be pregnant because she'd never had X. That was positive too. We gave her a few minutes to herself to figure out what the hell happened, and when I returned to check on her a short time later she asked me if she could get pregnant even though her boyfriend didn't go all the way in. She 100% believed that long as his anus wasn't entirely in her, it didn't count as X. It took nearly a half hour of explaining reproduction to her for her to understand that whether it's halfway in or all the way in, sperm travel. Optometrist here. Patient booked in for an emergency appointment with a raging red eye. Clearly very painful. Look under the microscope and the cornea is really not happy. Wobbly reflexes, haziness, the works. Me. What happened? Patient. It's my niece's wedding this Saturday, and I wanted to tint my eyelashes to match my hair and the color scheme of the wedding, light blue. So I used the same dye for both to match the color. Me. Does that hair dye contain ammonia, by any chance? Patient. I think so. Do you think my eye will be better by Saturday? Will it match the color scheme? Me. Unless you can convince then to change the color scheme to red, no, and #X200B, and #X200B, and #X200B, and #X200B. Edited because I read a comment about healing crystals and now I remember a story from a colleague. Patient attends a routine test complaining of gradually reduced vision, which turns out to be dueto cataract. My colleague offers referral for surgery. No need, exclaims the patient. I know what I need for this. I have lapis lazuli at home. 6 weeks later came back for the referral, and #X200B, and #X200B, and #X200B, and #X200B. Second edit for remembering the first story that made me question my sanity. Elderly patient attends with concerned family members because the patient ran over a pop-up tent in the side of the road that the telephone engineers used to protect themselves from the rain. Luckily no one was hurt as the worker was on lunch. Worried as to how the elderly driver missed seeing a large, red and white tent in the middle of the day. It was then that the elderly relative admitted to having spent the last 3 years driving from memory. Plenty. Although the one that always sticks in my mind is a patient I met during my early years on a palliative care ward suffering from terminal cancer. She was only in her early 30s, and the only reason she had gotten so far gone was that she had relied on the healing power of crystals rather than, chemotherapy. 73 here. Former clinical microbiologist, long ago. Still, I found myself all over the clinical lab at times, not just infectious disease. So, one day, this 20-something guy, wife and mom in tow, Walks in with a paper request for MN analysis, pre-computer era. Okay, not the most comfortable encounter, but I'm a professional and did this drill many times. He had not been briefed by the doc and had no idea how establishing infertility in males was done. Well, okay, a challenge. Then, I took him aside and, using standard medical terminology, told him how a diagnosis is made and what he needed to do to provide a specimen. He wouldn't believe that I was asking him to masturbate into that container. Astonished. Then he played dumb, as if the word was unfamiliar to him. We looped through the medical terms and procedure again, and I eventually resorted to every word I knew to describe the act. It was like a George Carlin bit. A half hour later, he emerged from the toilet with 2 inches of urine in the cup. God almighty. The report went back, patient provided improper specimen. Former practicing surgeon. Male came in with a small bowling pin up his backside, for the 3rd time. I don't know if cleaner in a hospital counts, but this one time I got to work early on a Saturday morning and we immediately received a request for help from the ER and got sent over by my boss. When I got there, the first thing I heard was yelling from this guy behind one of the curtains. He was shouting at the nurses, "Don't touch my penis," and, "I didn't use any drugs." Then Ismailed iron in the air, and then I found out there was blood all over the hallway, handprints in blood against the wall. Almost the entire floor was covered in blood with actual puddles in some places. What happened? The guy pulled out his catheter, causing arterial bleeding, and decided to run away from the nurses who were trying to help him. It seems like he lived through that. I never seen that much blood before that day nor after. M's here. Had a diabetic in his 30s to 40s who refused to take insulin since 2012, it was 2020 at the time. When I took his blood sugar is only read as high, meaning it was over 700 for glucometer to notrate it. Upon seeing this, he asked me if that washa and then went, "Is this cause of all the ice cream I ate?" Played Facebook Messenger video with his girlfriend the entire time. Met him later on the parking lot after he got discharged, and it took this man less than 50 paces from the ER door to rip off his bandage covering his IV and play with the IV wound until it started bleeding all over the place again. Knocked on our ambulance door and asked for a band-aid to fix it. We had to walk him back into the ER and bandaged his entire arm with gauze so that, hopefully, by the time he got it off it would have clotted enough for him to not end up exsanguinating himself. I overheard a conversation between a nurse and a doctor and a patient in the ER. They were trying to figure out if he was very stupid or has a head injury. It was both hilarious and sad. He kept telling them that he was there for a hurt leg. He couldn't explain why his leg was hurt, how it was hurt, how he got there. Nearly anything. I heard them taking in a hallway to each other. The nurse was convinced he hit his head. The doctor said, "No, he is just an idiot." Turns out the doctor was right. They go a hold of the guy's wife. She basically told them in the hallway he is always this dumb and if she leaves him he would get lost in his own house and starve. Edit. It sounded like his leg was visibly injured or swollen. But when asked what happened or how does it feel he gave nonsensical idiot answers. Not like slurring but in a regular idiot voice. "It feels hurt. I was talking to Jimmy and we were doing our usual work and my leg hurt." "Doc, did something happen?" "What is the work?" Him. "Something always happens, you know how it goes." Quote, "I just want my leg fixed." Not a personal experience, but one from a colleague of mine. I only saw the pics, so this 60-something-year-old suffers from an ACUTE complication and gets a pacemaker to solve the problem. Everything goes normally and as planned, he recovers, every care and meds that he needs totake are prescribed, explained in medical. Appointments with a cardiologist or ophthalmologist are scheduled so that he may get the follow-up he needs. The man then proceeds to never show up to any appointment and never answer any calls from the hospital to know of him and reschedule. This went on for around 3 years. Until he shows up without former warning and asks to talk with the doctor that did the procedure to put his pacemaker. People are weirded out, but seeing that on that day the doctor was present and this patient was in clear distress, they talk to him and manage a couple of minutes to have the doctor check on him. Inside the appointment room, the doctor takes notice that this man is wearing a bra inside his shirt. The man explains he has been wearing his daughter's bra for 3 months after his problem got worse. The shirt is asked to be taken off and there he stands, the shirtless man wearing his daughter's bra, showing off the pacemaker, that should have been kept inside his body, dangling outside of it, being held by the left bra cup, with a big infected open wound above it with the pacemaker leads still inserted onto his veins and connected to his heart. Nobody has any idea how the man let that situation come to be or how he didn't die of sepsis or any other health problem that may appear for that matter. TLDR, man gets a pacemaker. Doesn't show up to appointments. 3 years later comes to the hospital looking for help, wearing his daughter's bra for 3 months to serve as a holder for the pacemaker that got out of his body from his infected open wound. I'm a nurse. This isn't about a patient, rather than my dad. He is convinced that insulin is what ISGIVING people diabetes and doctors are prescribing it just to make money. After 30 minuets of telling him why that's wrong, he said not to be so liberal, and I didn't understand because I'm not a doctor. A woman called 911 because a cougar attacked her cat. She thought we could help the very clearly dead cat. A man called 911 because a cow bit him. He didn't want EMS or an assessment or anything. A man called 911 for an itchy utthole. Took him to the ed because we have to. The doctor asked the patient if he had put the cream on his utthole that he gave him last time. Patient said no. Next time patient called us for his itchy utthole, I offered to put the cream on his utthole for him. He declined. Took him back to the ed. I work in clinical research at a hospital. Basically, for patients who have cancer and don't have other standard of care options, clinical trials, experimental treatment, are a viable option for many. Some people have a negative view of research, but it's highly regulated and not as scary as it sounds. We go through the consent form with this patient, who has a history of drug abuse. We don't know everything about this new medication, but one thing we do know is that using cocaine while taking this drug will make your heart explode, in layman's terms. This patient promises they're off the sauce and that they totally won't do cocaine while they're on the trial. 2 weeks later they relapse, and, well, you can figure out the rest of the story. This was one of the funniest yet cutest one, was a student doing a shift in andrology, reproductive health doc. So you're trying to have kids but not managing to. So do you have any other kid? Patient: yes doc, I have one. Doc: okay, so we need to do this and this and that. Patient: okay great. Then he proceeds to visit him and stuff, after which he goes away. After a couple secs he knocked the door again saying, hello doc, my wife told me that it would be relevant to you that the son I have is adopted. But that's make no difference to me, I always considered my own son. Woman comes in with no prenatal care to labor and delivery in labor. OBGYN resident taking a history. Do you have allergies? Patient: yes, I'm allergic to water. Resident: okay. What kind of reaction happens when you drink water? Patient: oh, it makes me pee. Yeah lady, that's a feature, not a bug. Not me, but sibling. I don't think he'd mind me sharing the story just on the off chance it prevents someone else from making this mistake. Lots of surgeons have a similar story, but thankfully this one doesn't end in someone's death. Parents claim their child hasn't eaten anything before surgery, as they were carefully directed. Turns out they thought the surgical team was just being cruel to their child, and when she said she was hungry that morning, they detoured on their way to the surgical center and got her a full southern breakfast. She near died aspirating biscuits and gravy. I've rarely seen my brother so angry and disgusted. Somehow biscuits and gravy looks even more nauseating the second time around, and he was just recounting what had happened. I have no doubt he tore a strip off the parents once their 5-year-old was stabilized, and they probably still felt justified and angry at the surgeon for telling them what they could and could not feed their child right before anesthesia. ETA, the parents did in fact feel justified and hard done by, although a fake they didn't express anger at my brother. Knowing him, they didn't get a word in edgewise. Definitely no acknowledgement or realization that they could easily have killed their own child or that they'd made a bad decision. I remember they were annoyed by her whining for food. My wife is an anesthesiologist. When training junior doctors, one of the things she has go reinforce over and over again is that you never leave drugs unattended in an unsecured area in a hospital, even for a moment, because some people see drugs and think, fun, and take them if they don't know what they are and they just raided a trolley or picked up a syringe off a bedside table. And then, because the drugs used for anesthetics in hospitals are quite serious, those people quite likely end up dead or vegetables. And this has actually happened more than once in hospitals she has worked in. When I was in the hospital as a patient, there was this one guy in who really wanted to step outside to smoke. The nurses pretty much belted him on the table and yelled at him that he had complete kidney failure and they need to treat him immediately or he will die in the next 20 minutes. To their dismay, he didn't listen and tried to vehemently free himself and go outside and smoke. He was in his 30s. It is a mystery to me how this guy survived that long. Working midnight in the ER. Family brings in a 4-year-old at 2 a.m.-ish. I ask them what is wrong. Them. Ask him, the 4-year-old. He said he needed to see a doctor. Me. Did he say anything was wrong? Them. No. He said he needed to see a doctor, so brought him. A quick back and forth that firmly establishes that they actually showed up in the at 2 a.m. purely because the 4-year-old said he needed to see a doctor and they don't know why. Meet a child. Why do you need to see a doctor? Kid, the doctor has suckers. Me, flush. To be clear, it is the parents who lack sense and not the kid. Go see patient in labor. Explain through the whole risks, benefits and process of a labor epidural. Finish up procedure and have just secured the epidural catheter to the skin. Husband asks, how is she supposed to pee through that small a catheter? My aunt. She was diagnosed with cancer. Instead of getting treatment, she went hardcore vegan and prayed, refused to use any med. Doctor said she could have made it for few more years. She died after 6 months.